Hello, everyone, and welcome back to the Byrne Bright podcast. My guest today is Dr. Dunia Alhashimi, a retired pediatric emergency doctor from Bahrain who spent decades saving children's lives, lecturing at universities and medical institutions, and shaping the next generation of doctors. Since retiring, she has continued to throw herself into new experiences, hobbies, and challenges. Someone who grabs every opportunity, says yes before she talks herself out of it, and refuses to be defined by stereotype, expectation, or convention. A reminder that the life you want doesn't always have to wait, and that no cultural norm, social pressure, or self-limiting belief gets the final say. So without further ado, here is my conversation with Dr. Dunia Alhashimi. It's strange times here. Just to confirm for everyone, we're in Bahrain.
We are, very much, and safe and sound.
Yeah, thank God. And how has the last month been for you?
The last month has been different, I would say. It reminds me of COVID times when we had to, our plans have been disrupted. We had stuff like that. We have to sit low. We have to be at home. And, kids are now people have to work online. So I think COVID prepared us for this. So it's not a big change.
Yeah. I was speaking to someone earlier about that. They were saying it's kind of COVID on steroids, or there's still that sort of trauma from COVID.
Yes.
This is kind of bringing things back, bringing those feelings back.
Yeah.
But in a different way. It's a different sort of danger, I guess. But from an outside perspective, a lot of people are very worried about people in Bahrain, which is understandable because of what's been going on and because of everything that's in the news.
Yeah.
And the images, the videos, and I have a lot of family back home that just say, when are you going to come out? When are you going to leave? And I understand the concern, but at the end of the day, Bahrain is my home.
True.
It's not one of those, it's like if you tell someone in their home in somewhere else, you just need to get up and leave. It's not that simple. But I understand for some people, it's quite jarring, it's quite scary. And they may have not experienced that.
It may be more scary for people from outside. They always they don't understand. I mean, we're fine. We're really okay, and we're safe. There's nothing, and life is going on. But people from outside, they just are more worried than. And I don't think there's a reason to be. Alhamdulillah, we're good.
Yeah, it's as long as you're being careful, as long as you're following guidelines. It's technically there is a war going on, and technically, I guess the region is a war zone, but in terms of safety overall, thankfully there hasn't been that many people injured or that many casualties here.
Yeah, alhamdulillah.
And I feel sorry for the people who has happened to, or people who have been injured or killed. But yeah, as I said, it's my home here, and I'm not going to just easily leave. But that being said, I'll follow the guidelines and see what happens. But yeah, I'm not, and I do understand why some people have left. Some people have young kids. They've never experienced that level of, I guess, danger or that type of danger before. And having young kids, that adds another level of concern, I guess. So I do empathize with that, or I do sympathize with that. Yeah. So, but I mean, I always try to look at the silver linings of these things, and I am working from home all the time now, and it just gives me a bit more flexibility, I guess, to do other things, like this, like editing, and it's I just try to look at the positives of these things.
That's right. Yeah,
I'm sure you do as well.
For me, I'm more grateful because I'm retired. The only disruption that happened to me hasn't happened to me is my traveling plans. I had traveling plans to go on April, which was supposed to be on a cruise with my youngest kid. Okay. And we had planned it since last year. So unfortunately, we had to cancel the cruise because we weren't sure. It's going to be towards the end of April, but there were no flights, so we had to cancel the cruise, and that meant we've lost like half of the cost of the cruise.
Yeah.
But this is life, and as long as we're safe, we can always like travel again later on when it opens.
Yeah.
My youngest, she was understanding. Poor thing, she works very hard, but she was looking forward to this vacation.
Sure.
But that's the only thing that, and I'm sure a lot of people also are in the same position, like they had traveling plans and that has been disrupted.
Sure.
But it's for our safety. I was like, other friends were telling me, Dunia, you could always travel through other routes and all that. And I said, no, when you travel, I travel for pleasure. And when you want to travel, you want to be carefree. You want to be thinking that, I go to the airport, my flight would be, canceled. I would have to go to different cities. And there's no fun in that.
Sure.
It's better to travel when everything is peaceful and quiet again.
Yeah. When you don't
We
have to really
hope
think.
soon. We hope soon.
Yeah, hopefully. And yeah, you can replace experiences and material items, but yeah, the others you can't. Yeah, your health. So yeah, I think let's see how things unfold.
Yeah.
But for now, I just want to tell my family that I am fine.
Yes, Patrick is fine, and we are happy to have him here, and he's doing a great job. It's really good.
Public service announcement. But yeah, and I'm just trying to think where to even start. I guess I don't usually give like formal introductions on the podcast. It's usually in the intro, but I'd love for you to, I guess, introduce yourself and give a little backstory on you and maybe, I guess, how we met. But yeah.
Wow. Yes, Patrick, I met you at Toastmasters. It's interesting that I have always heard of Toastmasters, but I've never actually joined, or maybe because I was very busy or I didn't have the right person to tell me, oh, this is Toastmasters, go there. Interestingly, like I met one of the Toastmasters members in a sport event. I happened to take part in, those run/walk events that used to happen weekends with many groups. And I struck a conversation with a total stranger, which I usually do. I'm quite infamous for doing that, meeting people and talking to them. And he mentioned Toastmasters, and I said, "Wow, I would go love to join. I'll give it a try." So you see, Patrick, I am a retired physician. I have been a consultant pediatric, and I specialize in emergency. I worked for the government for nearly 30 years. At the age of 55, I decided I will take early retirement. Of course, I started my family a bit late. I was in my 30s when I had my children. So as they were growing up, I realized that I needed to spend time to them. I would blink and they will be leaving home. They will be married or, they leave home, they'll go over somewhere else. And I said, I want to travel with them. I want to spend time, get to know them. So I retired from the practice. And a year later, COVID happened, which was, well, at that time, of course, we spent it to bond. And two of my kids they were studying now, or they came back, they were in the UK. And so they came back and they were at home. So they were doing their studies online. So it was a perfect time for us to, bond a little bit more. Sure. We had activities. And the other thing I would like to say, Patrick, is that I'm an artist now. I took art a few years before retirement, very incidentally. I had my second child wanted to be an architect. So the university, they were like, to be an architect, you have to have an art portfolio. So I took her to study art very nice Filipino artist, very good, Carlo Rico. And Carlo taught her how to, draw and, everything. So I was standing there and I was like, Carlo, I always wanted to learn how to do oil paints. And he said, I can teach you. I said, yeah, really? Can you teach me how to oil paint? I've never touched oil paints in my life. And he said, of course. So I said, yes. And I took an oil paint class with him. And for the moment, he gave me the basics. And he was saying, wow, Dr. Dunia, you are really natural. You have a talent. I said, really, I do? And he said, yes, look at your strokes. How did you learn that? And I said, I don't know. It just came naturally. So from there, I started painting. And then I joined the Bahrain Art Society and joined exhibitions from then. And even managed to sell a few of my paintings, which was really impressive. Yes, yes. So this is one thing that I really loved. The other thing that I love as well, besides art, is reading. And I have a beautiful library, which my daughter, the second daughter, had made for me, which is after she moved out from the house, she converted that room into a library. And it's a beautiful library, and it was a beautiful present from her.
So that was her thanks to you for...
Yes, I suppose. Yeah. Because I was running out of space. And I was I had the room that I had, the library, I converted it into an art studio. And so now I don't have place for my books. Okay. So my books, I had to donate them. So I donate them to the Bahrain Society for Against the Prevention of Animals, Cruelty, and BSPCA. And but I kept a few books that I really loved in boxes. Those hard copy, those ones that are special. Yeah. I kept them in storage. So when she made the library, I said, yes, now it's time to display them. So right now, I spend most of the time in the library reading, going over new books. And I'm purchasing books, and I really love it. That is there is one pleasure. I can't describe how much reading, the pleasure of reading gives to me.
Sure.
It's wonderful. And so the third thing I do beside art reading is travel. And I've traveled right towards COVID, which we had to do with all the tests and all that. It was very annoying with all that, vaccination tests. And then yearly after that. So I managed to see a lot of things, which is really good.
Good for you.
Yeah.
In terms of the reading, what's your genre? Do you read nonfiction, fiction, everything? What's your...
Yes, interesting to say. Earlier on, when I was younger, I was more of a fiction person. I used to read stories. Ever since I was a little kid, I liked mystery books. And I remembered my teacher giving me a box. You should notice that I used to go to the library and the school library and get the book. And so I used to write Enid Blyton. I don't know if your generation, you remember. Yeah. I mean, that there used to be the famous five, blah blah blah, all those books. And then I went into Agatha Christie, and then I was and I progressed into more and more of these mystery, crime, blah blah, mystery of books that make you think who's done it, whatever, the kind of thing. Patricia Cornwell, Michael Connelly, Robin Cook. Those kind of books. As I got older, I started entering into a different phase, and that is to the nonfiction. And now I combine fiction with nonfiction. But I would say now I am more of a nonfiction. About a few years before about 9 years before I retired, while I was working as a pediatric emergency consultant, I took I wanted to do something else. I was like working very hard at the emergency. It is very kind of tense environment, and you sort of like want to do something different. So I was looking up what kind of master's degree I could do. I already had my fellowship and I already had my membership, but what kind of master's degree I would like to do. And I came across healthcare management, and I was like looking through the modules, and I said, wow, those are very interesting modules. Modules like leadership, operation management, organizational behavior. Those were things that I never learned in medical school. And so I said, you know what, I want to do something, I want to learn something completely different from what, I have been exposed to all my life. And I took that. And I was going through the master degree program. I took it very seriously, Patrick. Every module, you would imagine, I used to buy like 5 books on that subject. If it's leadership, I would have like 5 or 10 books on that leadership, and actually buy those books and read them, devour all that information. And so it sort of like opened my mind into something really different, different kind of knowledge that I have attained. And from there, I started reading about psychology, about and then philosophy and stuff like that. So these are mostly the genre I'm reading right now.
Okay. And yeah, as you said, in your career, you were on a kind of a very specific path of learning and of reading and whatever literature you went through. But finding this sort of stuff in leadership and everything else, that completely opened up a new, I guess, world of possibilities to you.
Yes. Not understanding of people. It also helped me in my work. And as a consultant, if you understand in the medical field, and especially in the hospital, it is more of a hierarchical kind of work environment. So you have the consultant, and then you have someone who just below is called a chief resident, and then you have a senior resident, and then you have a resident, and then you have an intern. So you have all these people that you are sort of like responsible for, that you are training, and that you are making sure that they get the skills and the knowledge that you have, and then you overlook their work and make sure that the patient at the end of the day is safe and has the right diagnosis. So that study taught me how to like manage people, how to be a good leader in a way that I could motivate my the resident and the people I work with. And how to actually understand myself, understand what kind of person I am. And so I've gained tons of knowledge from that master's degree.
Sure.
And the instructors were they were so happy with me in the way I was so motivated, and I had that hunger for knowledge, and I wanted to read more and more. In fact, like I wasn't even like planning to excel. But because I took it so seriously and I was studying so much, I got a distinction in that master's degree. Yes, and the fact that after I finished, they told me come back and modulate, like teach the other master's degree, candidates, and I did that for another like 6 or 7 years.
Wow.
So that was like one thing and I still keep those books. I still go back to them. I still read them. I read a lot of books about leadership. And attended several, I did a seminar. I remember I was amazed with John Maxwell. I attended his seminar and I asked him for, to autograph one of the books.
Yeah.
And just recently I was I took it up again and I was I'm rereading those books. So it's...
Good for you.
Thank you.
Yeah, good for you. And you said, obviously you were working in positions of leadership in the medical field. And this is just my own curiosity, but when you're studying to get into the medical field, I guess sometimes they may not concentrate on the people skills aspect in the
Yes.
course. It's more, I guess, the technical learning.
Yeah.
But some of these courses, I guess, maybe don't prepare you to be able to actually lead people, understand people, how they think,
Yes.
understand your own thoughts.
True.
And I guess you finding the passion in that literature helped you to, I guess, close that gap and be able. And would you say that completely changed and improved your way of thinking about leadership?
Yeah. It has, in fact, after I read all those books, I realized that, as you said, it's true. In medical school, we are taught how to, the technical stuff, the diseases, the symptoms, how the patient comes up, what's the treatment. And there was one thing that was missing, and I thought, is the communication. How do you communicate with our patients? And doctors think that, I'm going to just sit with the patient. I'm going to tell him, this is your disease. This is the medication you have to take. Take it this many times a day this many times for this many days, and come back in 2 weeks. You're going to be, and then I'm going to check on you. I'm going to do this blood test, and you're going to be all right. But that is not what, the reading that I read. The reading I read is that I had came across, of course, if you had, you've read about emotional intelligence. And that was one book that was really by Goldman. And when I read that, I realized, yes, empathy is not actually taught in medical school. It's presumed that you should have empathy for the patient, but how do you go about it? So the thing that we have to learn that gap is the communication gap. How do you communicate? How do you become an active listener? How as a doctor, you become patient-centered. You bring in the patient. And then came more and more studies of how evidence-based medicine is. So you have to do whatever you are practicing, it has to be based on evidence. And this evidence has to be also conveyed to the patient. So the patient gets to know about this evidence, and he also has to be involved in this. So involve the patient in the decision making. Many patients like that. They want to know, what are my options, doctor? But sometimes what happens is that the doctor is so busy, so overwhelmed, it becomes like a one-sided. This is what it is. You do it, you take it, and no questions asked. But it doesn't work now in the 21st century. Patients have become so educated. We used to laugh as medical professionals. We said that, sometimes we have those Google parents, they come home, they come to the clinic already with a diagnosis. They are extreme. There are very few, actually. But if you actually discuss with them and, tell them yes, or, this is actually, this is the research. This is what it is, the events. I'm following guidelines. These guidelines are based on research. And I'm going to send you those papers. You can read them. I'm going to send you those sites. They will be very receptive with that kind of, being involved in their management. As a pediatrician, I had to deal with both the child and the parent. And most importantly for me was actually the parent, getting the parent on board with the medication, with the treatment. Of course, the child, for me as a pediatrician, had always talked to the child. I always talk to the child, involve them as much as their development can allow. It's different talking to a 2-year-old than from a 5-year-old, a 7-year-old, 10-year-old, or even a teenager. It's always different. So we have to tailor our conversation, our communication according to that age
Sure.
and their understanding.
Yeah, and that's really important because it goes back to the emotional intelligence side of it. Conventional ways of communicating medical issues with patients was usually kind of, back in the day, was probably very matter of fact,
Yes.
and it was missing that human touch,
Yeah.
I guess. But depending on how you communicate that to someone, say if you're diagnosing them with something, even if it's not that serious, how you communicate that to the patient, that will affect how they deal with it and how they respond to it. So I think it's good that you're looking at closing that gap
Yeah.
with how you communicate it and how the person then can receive that. Because if you tell them in a very kind of impersonal and matter of fact way, it can just feel very cold, I guess, and you can
Yeah.
they might feel scared. They'll feel that they're on their own. But
Yeah.
if you approach them in that way with empathy and with kind of a human touch
Yeah.
and understanding, I think they can navigate it and deal with it much better. Am I getting that right?
Yes, true,
Yeah.
Patrick. And as I was reading more about communication and I was reading more about emotional intelligence, I conveyed this knowledge to my resident. And I used to give like seminars and I used to give do workshops for them. And I was always talked about the communication loop. It's a loop. I tell you something, and then for me to know that you understand, you have to bring it back to me. You have to close the loop. And so, as a patient, as a doctor, sometimes it won't work if I talk to you in a very condescending and very cold manner, and just tell you this is what it is, and come back in 2 weeks. I'm very busy, very long list. So before the patient or the parent leaves, I'll ask, can you please repeat what I have just told you? So if he repeats, then I will say if he has actually retained the information. So this way I close the loop. And before they leave, I said, is there anything else you would like to tell me before we leave? And then I also tell them, please, for the next appointment, please write down all the questions that you would like to ask me. Because what happens, they come into the interview, they would be maybe nervous. They probably didn't want to take so much of the time of the doctor's time, and so they'd be embarrassed. But no, there's no embarrassment in this. Please, get your questions. I don't mind even if you go to Google and Google whatever questions you like.
Sure.
But as long as you are informed and you are well informed, and then the communication loop is closed. I tell you something, you return it, you tell it back to me. Then I understand that you understood, and so we're good. So you go home. I'm sure you're going to go and follow the treatment plan, and things will go well.
Yeah, because you're ensuring that they can go home comfortable knowing that they understand exactly what you told them.
Yes.
Because I'm sure there's a lot of cases where there's assumptions made. The doctor might assume what they've said. They may not have said everything in layman's terms. And then the person goes home half informed, and then they can tell their family that this is the diagnosis, and then it's just a complete breakdown in communication.
Like you said, Chinese whisper becomes like China. And it's very, very important because we cannot just presume that the patient understood. They may shake their heads and say, yes, doctor, I understood. And then we say, okay, yeah, they're fine. They sound very intelligent. They understood. No, don't presume. So in medicine, and especially in emergency medicine, in the field that I worked, we never assume anything. Everything is double checked. For instance, if we are having CPR, which is cardiopulmonary resuscitation, and we at once attain who is going to be the leader, who is going to give the instructions. Someone has to write it down. Someone has to convey it back. Whoever is writing it down says it loud, so everybody hears it, and everybody is doing everybody knows their role. So in that way, we have checklists as well. So no assumptions that, it was right. Dose has to be double checked, everything. So that is the way to, prevent, mistakes. We don't want that because mistakes cost life. And for instance, a patient, instead of me telling him, or a doctor, sometimes junior doctors, instead of saying, give the patient 5 ml of medicine X. But what does 5 ml mean? So 5 ml means a 5 milliliter, which was almost like 1 teaspoon. But then this 5 milliliter of one medication may contain a different strength. So let's take paracetamol. You can have 5 ml of paracetamol, which is like 120 milligrams of paracetamol. We can also have a 5 ml of paracetamol, which is 250 milligrams of paracetamol.
Okay.
So don't presume that they are going to buy the baby paracetamol, which is the 120. They might go to a pharmacy, or they might just go to, because some of these medications are on the over the counter, and just take it, and then they will overdose. The child would overdose on that. So say it in words. Say it in words, not just in numbers. Write it down. Make sure the patient goes home with the correct instructions. Everything is written, everything is documented, and the communication loop is closed.
And that communication loop, is that something that you learned initially when you were studying, or is it something that you came to sort of realize that was a really important thing to introduce into your work on your own reading?
This kind of communication and the communication loop, I also studied when I went to Australia and to do my fellowship in pediatric emergency. There I was exposed to different kind of a different kind of training. It was very structured, emergency medicine. During the period that I left, there was no pediatric emergency. So I was the first pediatric emergency doctor to go and train. So everything was new for me. So I learned that there. I learned about, having a structured, CPR, documenting everything, having checklist, all that. But what I really learned more is when I actually took the master's in healthcare management, and I studied all those, and I read all those books. And it opened a lot of, my eyes to a lot of things that I could improve in our, healthcare, and the teaching of my colleagues and my subordinates, the residents and the medical students. So I was also teaching in medical school. Initially I taught in Arabian Gulf University, and then I became a clinical lecturer in the RCSI University College of Medicine in Bahrain. Then it was my chance to introduce these people to, this is how you communication, learn more about it, be receptive to what the patient is, look for nonverbal cues. Sometimes the patient will not say what they mean, but you can make it out from their body language, from their face, from their gestures, all that we learn. And especially in pediatrics, as a pediatrician, I became more in tune to what the child, because some children cannot talk. You have babies who are nonverbal. How do you make out this is a sick patient from a well patient? How do you know this patient is not well? By just observing. So observation was a very intricate part of my work. Observation of nonverbal cues, of gestures, of body language. That was something that I also had to teach the residents and the doctors with me about, and teach myself. Until today, I'm still reading about it. I read about it because it's useful in every part of life.
Yeah, because there's so much nuance in each person and their nonverbal cues.
Yes.
Myself, yourself, everyone else, children, and some people, we can sometimes oversimplify things and assume that one person's nonverbal cue or their facial expression means the same as the next person, but that's not the case, especially in children. And there's people, children who are maybe neurodivergent, and a nonverbal cue that they have may be the opposite of a nonverbal cue of I don't know. Do I like to use the term neurotypical? Because I don't know.
Yeah, neurotypical. Either it's a neurodivergent or a neurotypical. Yeah. So exactly. So a neurodivergent or autistic or anyone on the autistic spectrum have difficulty expressing or even interpreting facial cues. They will not be able to know whether you are upset or you're angry or that. That is different from their perspective, but it's the children or the parents, sometimes even the mothers, when they come with their husbands or their partners. How do I know that there is trouble? How do I know that there's something going on in the family dynamics that me as a pediatrician I should pick on? Because it's very crucial. Because if I miss that, it's a matter of, maybe this child is in danger, or the mother is in danger, or whatever it is, whoever the member is. Study the family dynamics. These come in the way they talk separately or on their own. Sometimes it comes up as symptoms that do not correlate with the clinical signs. So if you find something and then you say, no, that doesn't really match. So it's sort of like those books that I read on, investigative and, the kind of books that I read, the fiction came to me that, listen, I mean, there is something wrong here. I'm sure. Let me investigate further. Let me dig. Let me don't presume that everything is well because it's a very caring mother or a very caring father. Look how they talk. And it's usually, those. So I'm talking about usually how to detect child abuse or to prevent that.
Sure.
That was part of our training. We have to really be an advocate for those children. So learning that, observing the dynamics, observing how the mother is talking, observing how the child, how he withdraws, how he is not, how does he interact with each parent. That also it needs training and needs observation. So that was something that I also had to teach.
Yeah, and as you said, you were talking about looking for subtle signs of abuse between the dynamic of the parents and the children. Is there any kind of main signs that you would generally look out for in that scenario, or can they vary? Or is there any generally common one that you would look out for that people may not think of?
The most common, I would say, Patrick, is that the story does not tally with what the sign is. I would say, and we look at the child's developmental stage, for instance. If we are talking about a 9-month-old baby, and the mom will say he stood up, he opened the cabinet, and he took the medication, and he swallowed it. That doesn't match his developmental capacity, the developmental stage that he's in. This baby is not even able to stand on his own. Forget about, standing on top of a table or, grabbing a chair and, doing that. Of course, you have some of these babies who are advanced. Okay, so let's test this. I want to see if he can stand. I'm going to examine him and see whether he can stand, whether he will be able to that. But in most of that instances, you will say, you have to question, is this possible? And if you find that this is not possible, then you have to question what actually happened. Can you give me another explanation? Because this doesn't make sense to me. So they'll try to come to another story. Then the father will come, or the other parent will come, and he will say a completely different story. So when their stories don't match, and everybody gets a different story, so they don't tally, here there's conflicting information. Here my suspicion becomes even higher. So I have to really consider that there is something wrong in here. Something is absolutely not right. Another thing is that they would say that, you know, if he has a fracture in his thigh, which is a very strong bone, and they would say he just fell off his high chair. And I said, that is not possible, because to have that kind of fracture, you need a lot of force. And from a fall from a small height would not work. So that kind of thing makes you question that. So when the signs do not fit the story, this is the time when we have to ask for more, you know, look at it in a different angle. And don't forget that we shouldn't miss child abuse, or shouldn't miss a child that is in danger.
Yeah, even if there's only a small bit of doubt.
Yes.
You don't take that risk.
We don't take that risk. We don't.
And how do you, obviously, if suspicion is raised in you, but maybe the parent isn't aware that you're suspicious, how do you maintain that sort of covert level of suspicion? Because sometimes you maybe don't probably want them to know that you're suspicious of them, because that can further endanger the child, possibly. So how do you kind of navigate that in the moment with the parents, in how you approach them or how you question them?
So we don't want the parents to just grab the child and run away, or take them and then, you know, refuse treatment. That will not be in the best interest of the child. So what we're going to do is that we will document all that they said. And if we have any suspicion that this is not like it seems, it is like, it doesn't look like there could be a possibility, or we're suspecting that this could be inflicted on the child, or this is a form of an abuse. Every hospital has a team that is a child abuse team.
Okay.
And this is a team that usually involves a social worker and all that. So it's not like just me, that I have to keep this, and it's up to me that I have to progress into this.
Sure.
As an emergency physician or a pediatrician, my job now is to treat the child, treat the injury, treat whatever they have, the overdose, whatever they have. Raise this to the team. The team is informed immediately. Right there. I treat them. I do the initial treatment of the child, keep him stable. Now the child is well. I inform the child abuse team or the child protection team, whatever it is called in whichever hospital. You know, a child advocacy team. They will take this and they will investigate it further. And then it is in their hands. So they will do an investigation. They'll probably go home, look into the environment, interrogate the parents separately. They'll do it in an eventual stage. And God forbid, if it is something really serious, police might also be involved. There could be a court order, you know, the kind of thing. So in each country, it's a bit different. Like in the UK, it is very, very strict. You have to inform immediately. There are forms to be written, letters to be posted, everything. You have to jot down everything. And if you don't, the doctor would be in trouble. I would be in trouble for not picking it up, for not informing. I suspected, but I didn't do anything about it. That means like, it's almost being like complacent with the
it's potentially
what's
further
happening.
endangering the child and prolonging that abuse. And you said it varies from country to country. What would be the kind of differences that maybe you've noticed? Because I know you have traveled, you've lived in Australia, UK. What would be some of the differences? Maybe there's subtle differences, maybe there's big differences.
The differences is in the legislation. We don't have very strict legislations to punish the abuser or to remove the child from the environment that he is in. Unfortunately, but in the other countries, for instance, if the police is involved, if the child protection team is involved, social services are involved, they would actually remove the child from the parents until they are cleared. But that, unfortunately, we don't have it here.
Okay.
Yeah, which we don't have it here, and for obvious reasons, we don't believe in like removing actually the child from the parents. Sometimes what happens is that it will be taken to a grandparent. Or the court will order that the grandparent will take care of the child.
Sure.
So that's one of the differences.
Main differences.
Yeah, main difference.
In terms of how they can approach the parents to maybe remove the child from that situation.
But we do have cases that have gone to court. Maybe it has led to the death of the child, or it's very severe cases that had led to actually, the perpetrator being punished or imprisoned or whatever. It has.
Yeah. Okay.
There are cases.
Okay.
I'm not directly involved. I wasn't directly involved since I'm an emergency physician. I just take it down to the child protection team, and then they are the ones who are doing their job.
But you're kind of, I guess, the first point of contact that can raise that red flag.
Absolutely.
Pass it down. So it's probably a big weight that's on you. It's a big responsibility.
Absolutely, because if this patient came back, and then they said this is not the first time, they'll actually go back and look into the notes and see the previous visit, who saw him the previous visit, and didn't raise the flag. So it will be a big responsibility.
Sure. So it's, I mean, there's obviously a big moral obligation there, but there's also a professional and legal obligation too, to safeguard that child.
Yeah.
And in terms of, you had said about approaching obviously different age levels, age groups of children in how you speak with them and in how you, I guess, communicate any news with them. And is that something that you learned in your master's? That was, I guess, I'm trying to think now. Yeah, and how you communicate with, say, a toddler, and then maybe above that, what are the kind of nuances in that for you in how you approach communicating with a child?
I went into pediatrics. I coincidentally, I never actually planned to be in the pediatric.
Okay.
But as a child, a young girl, I always loved to play with dolls and talk to them, and have these kind of birthday parties, and I had these huge dolls. I asked my mom to stitch clothes for them, and cook for them and stuff like that. And I used to talk to my dolls. So when I came to pediatrics, and of course, I really loved immediately. I loved it. I loved the profession. I loved that I had this small being, and he is capable of communicating. So earlier on, I was like reading that even infants, newborn, actually communicate. They communicate to look to the eyes. They have the preference to the face, to the eyes. And they also have preferences. They like women more than men, of course, because of the mother, and they like pretty faces as well. But they don't look at that, and just look at them, and they love it when you smile. So over to my second year, I was preparing to do a diploma in child care health, and I went to Ireland for the first time in the Royal College, and to do the diploma in child health. And I was taken back. My clinical exam, I had studied all the cases, the examination of older children, all that, and then they gave me a newborn, and they told me assess for cognitive function. They want to know whether this baby is cognitively okay. Just newborn. And I was taken back because I've never actually considered a cognitive function of a newborn. Or probably, yes, it was probably just 2 weeks old. So I had this toy, I was doing that, and the doctor said, and the examiner wasn't happy. It was a very strict Irish examiner. And he said, no, took the toy from me, and he's like, I have this, like a rattle, I don't know what. And he took it from me and he threw it off. And he just said, with nothing.
Okay.
At that time, it hit me. Baby was actually looking at me. And I said, yes, there is face and there is eye-to-eye communication. He is actually communicating. So I was going this way and I was going that way, and it was following my face, and I was going this way. He was like, because we know that newborn babies, actually their vision is not that great. So you have to be at least like half a feet away, a few centimeters away for them to actually see you. Mm-hmm. So as I came closer and it was looking at me and it was smiling, so I was turning around. And then they said they were impressed. They said, yes. I mean, and I aced the exam, Patrick, for at the first attempt. And I was like so happy. I went back home and I said, hey, it's every baby, every child you are going to communicate with from that time and use that skill. Mm-hmm. So I used to look at the children. And then I read about the books, and I got myself educated about communication and about how to, talk to children and how to approach them. Of course, you have to gain their rapport, which is the most important part in communication. Mm-hmm. Is that you have to gain rapport. Like me and you, Patrick, we first met. Mm-hmm. We had a rapport. We had to talk. We got introduced. We felt, oh yeah, we have things in common. And it is a relationship that comes slowly, and it is not something that you can force on, a baby or a child. So the gaining rapport is something that I learned, and I quickly honed that skill, how to talk to the child at their level. And I got myself educated, although I wasn't even married at that stage. I didn't have children. But I had a baby sister who was 19 years younger than me, which is very interesting. And I used to use her as a guinea pig. Mm-hmm. And I was like communicating with her as well. And I had that relationship. But then I started also getting myself educated about what is the latest cartoons that they like, what is the latest. So every decade, I get myself educated about the trends. Mm-hmm. And what the children like, and what's their their interest, and how to talk to them. So a small child, a baby, I'll approach them with like very carefully on their mother's lap, smile, get down to their level. Mm-hmm. And then when my students used to see me, because, the worst thing that a child likes to see is somebody that's towering over them. Mm-hmm. It's very intimidating if you think you're only like 100 centimeters or so, or 200 centimeters high, and let's say 2 feet, 3 feet, whatever, and then somebody who's like more than 5 feet or 6 feet towering on top of you, and that's quite intimidating. So the best thing to do, as I learned, is to get down to their level, mm-hmm. approach them with a smile, compliment their clothes, mm-hmm. pretend that, I'm talking to their toy, I'm examining toys, some kind of diversion.
Sure.
And I think I learned a lot is the use of humor. Mm-hmm. And as you know, Patrick, since I joined Toastmasters, and I discovered that I have a sort of a hidden talent for humor, which I never actually, I know that I say funny stories, mm-hmm. but I remember like for the first time when I went and I gave a speech, and they were all like they thought it was very funny. It's an impromptu speech. Mm-hmm. And they said, where did you come up with these things? And I said, I don't know. It's sort of like naturally. And the use of humor is very useful, mm-hmm. when you are dealing with children, pediatric children, and very useful also for the parents, for the mothers. They are stressed. It's sort of like gets them at ease.
Breaks the tension.
breaks the tension, it builds trust. So I used humor quite a lot. And I remember that movie, if you have seen, by Robin Williams, when he was working as a doctor. There was really, I can't remember the title, but he used to have a rubber nose and,
Yes, I think I know the one you're talking about.
yes.
I can't think of the name.
It will come eventually.
Yeah.
But I know I was so impressed with that. I loved it. And I said, yes, this is something I could do with my patients and the parents, because you don't have to be a clown. No, I'm not going to be a clown, but I am going to use humor to make the patient feel better, for the benefit of the patient, to release the tension, to gain trust, to promote well-being, to make them more cooperative, and also that they will realize that doctors are actually human. It humanizes us,
Sure.
because instead of us being always the ones that giving orders, we are like, we are the doctors, I'm the consultant, and this sort of like, it can give a bit of, they'd be a bit scared, intimidation kind of thing, to relieve that. Humor is good. So I use humor, and sometimes the child would come in, and I always use it very frequently, and to the clinic. He'd be like 8 years old, and I address him by his name, and I said, wow, good afternoon, Ahmed. So you brought your parents with you for the appointment. So it makes him proud, like, yes, he's very important. He actually came, he brought his parents, and not the parents brought him.
Sure.
So it's very useful, the kind of thing. So it's like, and it's funny. I use stickers, I use lollipops, it's not bribery, but it's more of them having that very good experience. Sure. Like, the visit to the doctor, they would always remember. Memories, very good memories of a hospital, instead of them being, like tense and have like bad memories.
Because you said it's very intimidating. People are wearing these white coats, and they have name badges, and they're in this unfamiliar place.
Yeah, true.
But using humor and getting down to their level, you're breaking that barrier. And they're like, oh, this is just like a person, like my mother, like my father.
Yeah, true.
And it completely just, I guess, puts them at ease.
And I don't wear a white coat as well. I don't wear a white coat. I remove that white coat. I just wear, normal clothes, maybe blazer, maybe a top or whatever. But it's not never a white coat. I have my stethoscope around my neck. I always love to put like a teddy bear on it, a clip-on teddy bear or a tiger. Sure. And then I take it out and make them play for it. I give them my stethoscope to play with it initially, that they get like at ease. So it's this kind of techniques of communicating with patients and children, and getting down to their level and talking to them and gaining their trust and being in their rapport. It's crucial in getting the right diagnosis and getting their treatment and getting them on board with their problem. So when my students see that, they were so impressed. After so many years, it became natural for me, and then they loved it, and so they want to be like me. And I was like, this is one thing that any teacher loves, is one of his students say, you are my role model. I looked at one of you did a great job, and I want to be like you. After I retired by a few years, I was walking down in the park with my kids. We were going for a walk, and they were a group of young people. They came up to me and they said, Dr. Dunia. And I said, yes. Hello. And I said, we were your students. I said, oh, hi, how are you? How are you doing? One of them said, you know what? I am going to be a pediatrician just like you. We loved you when you were a pediatrician, so we are going to be a pediatrician. And I said, wonderful. If someone, one of my students said, this is what I like to be because this is a role model, and it gives me great pleasure.
Sure.
Yeah.
And you can't You can't ask for anything, I guess, more
Yeah,
special than
it's
that.
exactly because I remember back when I was in medical school, who were those role models? Who were those people? And I do remember one of the pediatricians there. She was so loving in such a way, and she treated us medical students like her children, and we were like so happy just to attend those rounds. She's so motherly, and I do remember her, and she was such a great teacher. So when I got opportunity to take pediatrics, I grabbed it. I said yes, this I'd love to be a pediatrician, and I want to be just like my teacher.
Yeah.
And the next generation said, okay, now I want to be like you. So it's
Yeah.
great.
Yeah, that's really nice to be able to, and it's like that with my teachers in school. You always remember the one that was really nice to you or funny or kind.
Yeah.
And it's you can't ask for better than that. I think you probably feel that you've done your job. Like you take comfort in that you've done
Yes.
all you can to inspire these people. And with your, I guess maybe slightly diverting into the Toastmasters aspect,
Yes.
because you had, I guess, picked up those skills in impromptu moments with children, with trying to
Yes.
bring them at ease, you were able to transfer that over into Toastmasters, into the impromptu speeches,
Yes.
which I was very impressed with, because you had just joined and you went head first
Yeah, true.
into
And I won prizes and contests,
did,
which
yeah.
is very
yeah, no, I
for someone who's quite new. And yeah, I loved it. It's sort of like, and everyone said it's sort of like it came out naturally. And I said, why didn't I even think of this all the while? I mean, this is my place. Of course, I had enjoyed painting and being in the art community. But art, it's a solitary, mainly, endeavor. You sit there and you paint, you put the music on, whatever, and you paint. Sometimes we paint as a group, but everybody's doing their own thing. Occasionally, we do have those activities when we go and we paint, outdoors and murals and volunteering to, beautify the place. But when I joined Toastmasters, I felt I had the skills that I had on all those years that I could be very useful. And I said I could use them now and inspire others, which is really nice. They were very happy. I mean, everybody in the club, I'm so glad. And as you know, Patrick, we do a good job of getting together.
Sure.
And talking and perfecting the skill of public speaking.
Sure.
So for some people, public speaking is more a very stressful thing to do. For me, because of the years of training, and probably maybe because of the personality and the way I was raised, and it's a lot of things, a lot of aspects that goes with it. I would like to tell you that I studied in a private school. It's like a Sacred Heart School. I graduated from there. It was an English medium. And when I was growing up, everybody, it was unheard of. Why would a father from a Muslim family take his child to a Christian, a convent, and get educated? The fact is, it all happened coincidentally because I wanted to get education. I wanted to go to school very, very early on, and I pestered my family. So the only school that would accept a child at 5 was Sacred Heart. So my father enrolled me.
Okay.
And but in Sacred Heart, as you said, we had those teachers who we remember very fondly. And the teacher that I do remember very fondly is my English teacher, Mrs. Trainer. I don't know whether she's Irish, probably Irish. I don't know.
Trainer.
But she used to tell us to speak English like the Queen.
Okay.
Very good English.
Yeah.
And she taught us English language, and she also taught us English literature. And then we had an American teacher called Mrs. Wons, and she taught us geography. At the side, Mrs. Wons noticed that I also had talent for art. How did she know? Because I drew perfect maps. And the drawings in my notebook were perfect. She was said, wow, I'm going to ask you to come and do art. At that time, we didn't have art as a subject in my school. It was an after-school activity. So you should take me in the afternoon. We used to go in the afternoon and we sit and we used to do art. So this is the kind of thing I remember about the teachers. So as I was growing up, Patrick, I went into a disruptive kind of phase, the teenager. And to make me more subdued or whatever, so we won't do any disruption in the class, probably I was a bit bored. It's mainly boredom. And so the business ones, we say, get up, explain the class, the lesson to the class, stand up, talk about this. So I was put on the spot. Come to university, somehow my classmate discovered that Dunia will be the spokesperson of the class. So the teacher would say, who is going to present this? And we had a subject called community medicine and some like groups, and then somebody said, Dunia will do it. So I stood there and I was explaining stuff like that. So sort of it came naturally, but I never actually took part in debate or in public speaking like my younger sister did, and I used to help her with the speeches, help her and go and attend her debate contest and all that. But I never really thought you should actually sign up for that. I suppose I had other interests during that period. I was more, action. I liked sports. I liked swimming and, sports. And I wasn't more into, this non-sport activities. So, but now I'm ready. Now I'm saying this is the time, and I'm having a blast, really.
Yeah, you've got more free time.
And I'm having a contest which I'm going to be online after 10 days. So hopefully I will win the district
I'm sure
level.
You will. I'm sure you will. And this is humorous.
Yes, it is humorous. It is humorous.
Okay.
As I said earlier, I mean, the club noticed that, I have a thing about humor. So
yeah, and you have I guess there's an element of self-deprecation in there. That's always a good one.
Very
and,
good.
Dry humor as well.
Yeah.
And I think, and it sort of breaks some stereotypes as well.
It does.
But yeah, I noticed that when you were doing the humorous stories. I think that's always a really nice mix. Is you throw in a little bit of self-deprecation, but there's always a little bit of I guess inspiration in there as well.
Yeah.
But that's a good way to get
home message or think that a lesson or whatever. But as you said, self-deprecation, because that's the as doctors we don't like. I have a lot of stories. But I wouldn't like to make fun of my patients. I wouldn't like to, to bring patients, their sufferings, and it's not funny.
Sure.
But so the funniest thing you could do is actually make fun of yourself. And there's so many things that, we as humans, we are not perfect. We are not perfect. Anybody that says I am perfect is delusional, because we all have flaws. And sometimes we try to hide these flaws, but it's funny when you use humor to make fun of those, and people relate to you.
Yeah.
And it's easier. And now I'm taking this whole thing quite seriously. Like every time I take an endeavor, Patrick, I go very serious. So I'm not like now researching comedy writing, researching about comedy, what is funny, what is not funny. And what is funny is self-deprecating jokes are funny because it gives a kind of superiority to the audience.
Yeah.
Thinking that she is not as great as we do. She also has her flaws. But it's a human when we recognize them and we laugh at them. So it's like we enjoy it.
Yeah.
And yeah, so that's how one of the stories, one of the speeches that I gave was about me and how I got into school, and the other one is the funny story that I won was about when the goat ate my notebook. Yes, the story I'm writing right now, or I wrote actually, and I'm going to take part, is also about it's also it's self-deprecating kind of a story. Stories are always fun, and it's always fun when you make fun of yourself in a way that it's relatable.
Yep.
You have a flaw that other people have, but they never actually discussed. No? Yep. And then if you say that it's okay to have that, and it's okay that, we are acknowledging this.
Yeah.
So, and we're finding the funny in it.
It breaks that tension, and then it makes you more relatable.
Yeah.
And you're pointing something out about yourself. I spoke with a guy who does comedy in Washington, D.C.
Yeah.
And he's a molecular biologist, but he has a big passion for doing stand-up comedy.
Yeah.
But he said a big thing is when you're up on stage is to always be the first. If you have a little quirk about you that's kind of obvious. He said, for example, if someone is missing a leg and they get on stage, you need to be the first person to point it out about yourself.
Definitely.
And if something else external happens, if something falls over and you continue without acting as if it didn't happen, he says it's better to just point that out, kind of to show that you're the one who's aware of it, as opposed to they might be like, does this guy know that? Yeah. So I guess that kind of plays into the aspect of self-deprecating humor. But I think it's a really good approach. And I think I generally gravitate towards comedians who are self-deprecating because it shows that they don't take themselves too seriously.
True.
And they can take a joke.
They can joke. It's there's a difference when you talk to somebody and you say something and they become so offended by it, and they take a really bad stand. And maybe you just commented on something which you thought innocently about it. I also have this. I'm just telling you, you also have it. But no, how dare you? How could you tell me that? I'm superior, and I got offended. And, that kind of person is who takes themselves way too seriously, and they think that they're more, superior. That is not funny. People prefer people who are humble, who are human, who are there, who will say like, it's okay, I have this fault, I'm going to talk about. It's different when you point it out with a malicious kind of intent. But if that person says it, it's fine. It's like...
Yeah, and you take that power away from someone potentially using it against you.
Yes, definitely.
Well. Because when
I'm short, like I say, I'm short. I'm the shortest person in my family. But so instead of that person said, oh, shorties are like that, la la la, use it against you. But I'm short and I'm comfortable with it. I'm happy that I am short, that kind of thing. Yeah. So, and I noticed that, one of my favorite comedians, I like Kevin Hart. He does a lot of self-deprecation, and he also talks about his family, and then, about sometimes it may sound like a really dysfunctional family, but it's very funny how they're like outspoken, they say things. And every time he comes to Bahrain, I always attend his show. Yeah. This is one of my favorites. Is
Kevin Hart.
Is Kevin Hart. I also like Trevor Noah. He also talks about his family. He talks a bit about himself, but his jokes are usually more universal about what his experiences are. Interestingly, that I was always I was reading and I said, what is the relationship between medicine and comedy, Patrick? And then I was thinking, Dunia, why do you like comedy so much? I go to comedy and I will be laughing, and I have a sibling who doesn't find it funny at all. And she'll say, why are you laughing? This is not funny. And I find everything funny. And then I was thinking, what's the relationship? Because us being doctors, there are some comedians who are actually turned into doctors. You know them, right, Patrick? You have that Ken Jeong who was in The Hangover. He was a doctor. He's a doctor.
Yeah, Bassem Youssef.
Bassem Youssef is a doctor. Is an English doctor, a British doctor called Adam Kay. He wrote that book. Now this is going to hurt. Like that. He's also a doctor. So several doctors are like, they like comedy, and they left there. Some of them actually left. Some of them are doing it simultaneously. So they know that there is a relationship between the use of humor and medicine, and also how the humor is helping them to cope in their very stressful job.
It's two very conflicting areas.
Bassem Youssef, as you said, very interesting. He came to Bahrain. I also attended his shows, and I follow him.
He's very good, and I guess he's come a lot more to light in the last, I would say, 3 years, 2.5, 3 years.
He was there since about since 2000, since the Spring Revolution in Egypt, 2011, 12. I don't know. He was there.
Yeah.
So he had the show there. He had the show on TV, and then he went and he migrated to the UK, to the US. But he's also one of the doctors who became one of my a colleague that I ran across recently, and she's still practicing. She's a younger colleague, and she said, we missed you, we missed your jokes, we missed how, you were the funny things that you used to tell us. And I said, wow, that's great. And then she would tell me one of my jokes, and she still remembers it. And then you see, if you meet somebody happy or laugh from a joke, and that joke also they retained it and they remembered it, you think that you've actually achieved something as a comedian, that somebody actually is remembering your jokes. So that is something that I remember.
And is that what, I guess, gave you a bit more confidence to take a chance with doing these humorous speeches?
Yes, definitely.
Like people actually remember.
People remember, and I got the encouragement from you guys, and you guys said, "Oh, Dunia, you go for the humorous, talks, and participate." And I just went for it. I just dived right deep in, and then right away. I wasn't even a month or 2 months into the club, and there I was giving.
You were in the infancy of it, and I was very impressed. And I think it was also because it may have been unexpected, because we were talking about breaking kind of stereotypes.
It is.
And
it is.
I think that added another dimension to the novelty of it, because I don't think maybe myself, being from the West.
Yes.
I probably just had these preconceived notions, and that you may not have gotten up to do that, but it was a real kind of joy to see that.
It is. It is. I agree with you. I sort of like break stereotypes. I'm unexpectedly I don't know, Bahrain, they say I'm a senior citizen, but in the US, other places, I will say I'm in my 60s. Anyways, so when you first look at me and he said, this old lady, you think she's funny? And I first came in and I was quiet. What I do is that I study the place, and people look at me and they will probably, as when the first time you saw me, so like preconceived beliefs or stereotype. She's an Arab, she's an old woman, she might not be funny, she might not be educated.
Just to clarify, you're not an old woman in my eyes.
I know.
I just want to put that out there.
I love to be old. I enjoy every single phase of my life, Patrick.
Good.
I enjoy it all. And I am not ashamed to say that my age, and I love it. I loved every single stage. When I was a teenager, when I'm in the 20s, the 30s, the 40s, the 50s, and now I'm enjoying the 60s.
Good.
And I am I'm really loving it because it's opening a lot of my mind about things, and I'm like now I'm more concentrating about myself, my health, my mental well-being, and I'm like, and now my kids are all grown, they're like in their lives. I'm a grandmother of one child, so I'm happy and I'm in a very good place. Alhamdulillah, I would say thank God, Alhamdulillah. And like you said, it's like they're taken back. Sometimes, I remember, I'll tell you a funny story. I was in Melbourne in 2002, and I had just joined my residency. So a month later, so I had help into getting the apartment and all that, and I was on my own because I had the kids were very young, and my partner said, we cannot cope. We can't get help, and I need to go back. I need a family, and you're on shifts and all that. Long hours. It was to be long hours. So he said it's best that I go back with the children, and we put them into their school so it won't be disruptive. So I was on my own, and I was working, and then the director, the head of the department, called me, and he said, so how have you been coping? I said, well, I'm fine, but I'll tell you, I find it very interesting because as I'm walking down the streets in my neighborhood, there's some strip mall, and when I ask people for directions, they will shout in my face very loudly, and then they will be using their hand gestures so much. And then he laughed, and he said, haha, that's so funny, because they don't know that your English is so much better than theirs. So, so they immediately presumed, because I was scoffed, that I don't know how to speak English. So it was so funny. And me being a comedian, sometimes I use it to my advantage. I said, so if I'm in trouble, ticket has expired and I had no idea, the conductor would come up and I would go, huh?
Play dumb.
Play dumb? Play don't know how to English? I said, oh, okay, never mind. And he will just walk away. So,
yeah. So you can lean into the stereotype sometimes, or the preconceived notions, or the unconscious maybe bias. You can use it to your advantage.
I did. And now that I confess to you, I did use it a couple of times, but I said, well, if they already have that preconceived, thinking about me, being like a foreign immigrant, they probably think that I'm a refugee or a foreign immigrant and I don't know how to speak the language. And so I said, to get out of trouble, I used it 1 or 2 times, but it was to my advantage. So then he was saying, it's so funny that your English is so much, much better than them. And I said, yeah, well, it's just interesting how people look at you. So, and I entered, like you said, they said, oh, she can speak perfect English. She is funny. She actually knows how to speak well. So that's, and I'm telling you, Patrick, it's I'm still a learner. I use it as a learning. I'm still learning. Before I went for the contest, I looked at so many YouTubes about, how those speeches were, what did the people do, and I studied it like a scientist. And this is one thing about my medical training, and I was like a doctor, and I used to do a lot of research. So I always think like a scientist. I think everything.
Break everything down to a science.
Break everything into science. Yeah. Study it, research it. Look for patterns, look for the knowledge and the thing about it. How do you hone the skill? How do you get the skill? How do you learn that? So thinking as a scientist is a very useful thing. I would advise anybody that, to learn more, to gain wisdom, gain knowledge, not just read just for entertainment or for the sake of reading, but actually read to retain knowledge, to investigate, and not take things at face value as well.
Yeah.
You know, research, read
Yeah.
more, you know.
You can break, I guess, any simple modalities even down to a science as well.
Everything
because-
is everything. Take everything as science. This podcast you're doing it as science. I'm sure you've researched about it, you've read about it, you find a way that, you know, you're going to do it better. And you are like learning more
Sure.
about it. So you're thinking like a scientist and not like an entertainer or somebody that's just doing it for that.
Yeah.
So this is how you improve.
Yeah, I guess when you're setting up the technical aspect of it, you think of it in that sense. But then the entertainment aspect, you also break that down into a science.
Yes.
We spoke earlier about expressions, how you speak, how you, so every modality can be broken down into a science. So that's a good way to look at it. Because I think I have, in recent years, I have tried to do that, but it's good hearing that from you.
Yes.
That this is something that you should apply to every aspect of your life.
Every of your life. Think as a scientist. Think of it as science. Think about it. Break it down. Research it. Do it. Everything. You know, everything in my life, I've used that. I don't just, you know, take an information from one side. I don't just believe it. I just go to the source.
Yeah.
I remember that sometimes people will send you some stuff on WhatsApp, and then they think it is the truth.
Yeah.
And then I won't. And then they just forward it to 100 people and everybody starts believing it. I don't. I go back and I research it.
Yeah.
And then I come up and this is not true. And I debunk it. And I said, look, this is not true. This is the research.
Yeah.
This is the basis of this. So don't believe everything you read sometimes, or even what you hear.
Or see.
Seeing, of course, seeing is believing. Seeing is believing, but in our era now, seeing on media now, you can't believe it because of the use of AI. And Photoshop and all that. But seeing in person, me seeing you sitting down, I believe you are here. But if it was taped, I wouldn't even know if it was you. It could be somebody else. It could be an AI, the kind of thing, you know. So always think as a scientist.
Always question.
I'll question.
Yeah, because I guess that's the way that with social media these days, that's how, like, short attention spans, they grasp onto the first thing that they see, they assume that's truth, they pass it on, and then that's technically like propaganda.
Yes.
There's a lot of people who might just send something, they've seen it, they've taken it at face value. I will always assume something is not truth
until proven. It's not true until proven otherwise. Yes.
It just takes a bit more digging, and then I'll send them back something that rebukes or a rebuttal of that, and they're like, "Oh, Mr. Sherlock Holmes." I'm like, "No, I just did a little bit of digging for an extra 30 seconds."
Yes, it takes a few seconds. I mean, now we're so lucky. I mean, the generation, they have all the information in their hand. They have the internet. They have books. They have scientific, platforms they can look. For us as doctors, we have a platform called PubMed, where we look into every paper, every research. So if I want to know what's the benefit of water, or what the benefit of, I don't know what, anything, or research that has been done comparing this against that, I will go to PubMed and look at the papers there. I will not go to social media or an influencer that probably doesn't even have any scientific, knowledge or done any research, and just says that this is how you should eat, this is what you should do, this is what you should drink, and then just take it and follow it blindly. Go back to the source, research. So investigate like a scientist.
Yeah, a healthy amount of suspicion, doubt, because that's just how things are sold these days. People sell you things based on the assumption that you're going to take them at face value. And this is sponsorships that come in with influencers.
Definitely.
They say, just drink this and you'll feel better.
Exactly.
Eat this but there's a financial incentive for them.
Definitely.
At the end. So you just always have that kind of suspicion hat on you, I guess, to say, and to also say that, to always be comfortable that you don't probably know enough about something.
Yes.
And that you need to know more. I think Have you ever heard of the Dunning-Kruger effect?
Yes, the Dunning-Kruger effect is when people think that they know more than they actually, I mean, the competency, it's not got to do with the competency and the knowledge. They think they're more competent than they actually are, you know? What they say is that people who have very little, small amount of knowledge are actually more dangerous than people who have more knowledge. And then I used to teach my students. We are like in different stages when we are studying medicine. First stage is, I don't know that I don't know. So I'm slate. I don't know what I don't know. And then you reach the stage that I know that I don't know. And this is the stage that you are looking for the information. And some people don't know that they don't know. They will just presume that they know these things, you know, and they will just go on. So the best thing for us to be in a stage when we say, I don't know. I don't know. I don't know everything. And I want to know. You know what I mean? And it's like that search for information. On the other hand, you have what is called as imposter syndrome. Some people have that. When their confidence is lower than their competency. They are competent people, but their confidence is low. So they have that imposter syndrome, saying, oh no, I don't think I am good enough. I don't know this. I don't know. I hope people don't discover that I actually don't know. I don't know why I'm given this title. I don't know. But they are actually competent, but they're just lacking that confidence.
Sure.
But on the other hand, if you have people who are low in competency and high in confidence, those are very dangerous people. Because they think that they know everything, but they are very low. But they have this huge inflated confidence that they know.
Yep.
And they're very low on competency. Those people, you know, are like that person, that influencer, or that
president.
I know anybody who.
I'm not going to name names.
We're gonna go names, but they are around. There are a lot of them around. And unfortunately, they make a very bad. I mean, they give other people a very bad time. And but you want those who have high competency with low confidence, to actually come up and say, yes, you have the competence. You are competent. You know. Yeah. Those are the people that, you know, we should support and help, because we know that their competency. They're always like scared that they might not be able to, you know, do the work, but then you tell them, no, just give them the push. You are competent. You can do it. You have the competency. These are the people that, you know, I look into, and recognize that you don't know everything.
Yep.
And that you are learning. You are a learner. You're a learning, lifelong learner, and never stop learning. That's the only thing.
Yeah. Because I think some people end up getting to a stage in their life, they retire and they're like, I've learned everything. I don't really need to continue learning because I've given myself to a career that's over now. Now I can kind of just concentrate on other things. But if you approach life with that mindset, like kind of chapters, but you're always learning. Yes. In each chapter.
Yes, learning something new. See, I learned about painting. I took it very seriously. I took courses. I painted. I participated, and I did all that. And then I went into Toastmasters, and I took it seriously. And I read books about it, and I researched it, and I went into it like a scientist, like I said. And people said, how did you do that in such a short period? Because I approached it like a scientist, and I approached it with being very serious. And I took it very seriously. I always take whatever endeavor I take very seriously. And people have that attitude. And if you say, okay, now I'm retired, I'm in my 60s, now for me is to rest. Rest is the worst thing that can anybody do. It's dangerous. It's very dangerous. What do you mean by rest? Rest your brain? Your brain is like a muscle. It has to be exercised. Yep. You have to learn new skills, and the only way, you know, what is the most dangerous thing about, you know, I mean, getting Alzheimer's or dementia, is when you don't exercise the brain, and then you don't exercise the body as well. So they found a connection between physical exercise and dementia. People who didn't exercise, so I go on and do exercises. I've go out with my friends, we go for walks, I go to the gym and all that. I also managed to lose weight, which was a very good thing. And I lost a lot of weight, which is really good. And I also took that seriously. I bought like more than 10 books on food and diet, and really good books that were written by scientists. And, you know, that were, I also have them on Kindle. I also have them on audiobook. So I'm covered.
Yeah.
Hard book, or in the car, I'm listening to the Audible book. When I go to sleep, I'm having a Kindle in hand. When I travel, I take my Kindle everywhere. I have to have the Kindle. I don't waste the time. Like, even if I'm waiting for an appointment, if I'm waiting for somebody, I have to have the book. I'm reading the book. I finished the book, but it's like I'm addicted to reading, Patrick. And I wish this kind of addiction for everybody. You know, that is the thing that will make your mind young. And I hope, you know, people my age and especially in my community, change. Instead of saying, no, you're too old. I'm very funny. I remember once I was with my daughter. We were in a kind of only women's beach, right? In Bahrain. It was like it was in a resort, and so this little girl came in, and she was from another Gulf state. Her mother came inside, and she was covered on all from top, and she was only showing her eyes. And she sat there scrolling into her phone. The girl was looking at me and my daughter, and we had like a grandson, and we were like playing. We were on the swings. Me as a 6-year-old on the swings. There was music. We were very happy. We were like clapping and stuff like that. Then she came up to me and she said, "You're an old woman. What are you doing? You should be sitting at home." And I said, "That's a funny thing to say." Because she's not from a different kind of environment, where the expectations of people my age is that they are not out and about, traveling on their own, or having fun on the beach, or being on the swings. It's like expectations. And I said, "No, that's not. Why don't you come and play with us?" She was taken back, and she was thinking that it's not something that she should do.
Yeah.
And she was only like 12, I think, or 13. So we actually sort of like encouraged her, and she sort of like started, breaking the ice, and she started like playing with us. And I thought and then she started having a blast. But it's not her fault. It's the environment she's in, the kind of stifling kind of thing, stereotype. This is the box you have to be in, can't get out. This is what expected of you.
Yep.
Yeah. Break that.
Yeah. And it seems like you've broken that a long time ago.
A very long time ago. And the credit goes to my dad, actually. Okay. And I'm very, very fortunate to have such a a progressive father, a father that my eldest sister is about 9 years older than me, and she was the first in my family that went overseas to university. And she studied in overseas in university. So it was like a normal thing. And my father used to go with her to visit her in her university. And the same thing happened. He said, and I do remember, and he was telling me, finish your studies, get your when I became a doctor, get your residency, and then get married. He refused me doing it before, sorry.
Okay, yeah, so he refused going the usual route of, I guess, getting married first and falling into that conventional aspect
Sorry.
no worries. Falling into that conventional aspect of like a Muslim housewife, I guess. And where do you want some more water?
No, I'm good.
You good? Take a second if you need.
Yeah, he said study, work,
Yep.
and then get married.
Okay.
So for him, education was a priority. And I'm really blessed because he also put us forward. He had no difference between boy and girl. We were treated equally. Although my older brother always thought that I was favored more than him. But I mean, it was only 2 years and a half, and we always have that debate when we are at my parents' house. And he said, you girls, we had to work. But I said, yeah, I had to work too. So we had a family business, and we used to work equally. So there was no difference between boy and girl, and also the attitude of can do. Yes, you can do it. You can do it, which is very funny. That kind of thing that I had also instilled in my children. You can do it.
Yeah.
You put your mind into it, you can do it. Toastmasters, yes, I can do it. I'll do it. I can do it. Winning the contest, yes, I can do it. I'll do it.
Yep.
And, we go with the mindset that it's not just for winning, it's for the fun of it.
Yeah.
And for the, yes, I can attitude, that there's no boundaries in your potential.
Yeah, you're breaking that self-limiting barrier, self-limiting belief.
Yeah.
That has been instilled in you, I guess, from yourself, from society, from culture.
Yeah.
And you have your father to thank for that.
Yeah.
Is that where you? Okay. And where do you think he got that from? Did he grow up in a traditional household, or was it passed down?
He did grow up in a traditional household, but he got educated in the American mission.
Okay.
So he was educated, he got education, he got to speak English, which is, we're talking about the 40s, 50s, the kind of time when Bahrain was still under British rule.
Yep.
And so he became a translator, and as a very young man. And then they encouraged him to get education. He got his education and eventually became a medical librarian. Which is very nice because, and when I was in school, we used to have Sunday off. It was very funny. We used to have Saturday and Sunday. Saturday. I think Friday or Saturday, Sunday off.
Oh yeah, because
anyway.
it was a Catholic.
Because of the church. Yes, so we had to have that, and so my mom, to get it out of trouble, and eventually my younger sister was also taken to the school with me. She's 2.5 years younger. So to get us out of trouble, because she already has other 3 children to take care of in the house. So she told my dad, take them to work. So it was take your kids to work day. So we used to sit in the medical library, us very small children, and take books and sit in that, those corridors and open those medical textbooks and look at them and try to decipher what is written. Of course, I used to like the pictures of all the anatomy. So somehow it's probably, it came natural that I became a doctor because I was exposed to that very early. So that was the thing he taught us. And, being in the business, come to work, finish school, go and help in the family business. So we were like, in the face of society, like dealing with people, selling stuff, and can attitude, which was funny. So my dad and then when I got a scholarship to study medicine, he was very, very excited, very, very happy, because he wanted one of us to become a doctor, and I was the first in my family to be, unexpectedly, and they didn't expect that. Because I was, the last few years before school, I was quite disruptive. But then I picked up my act and I got good grades. So he was taken back by this. Last person to expect to become a doctor, to go as Dunia, but I did. And I was happy. So he said, whatever you do, don't lose that scholarship. I'm going to come back home. And I said, and I had that threat on me. Because he was I had to. He wanted to make sure that I was taking it very seriously, because if I lose my scholarship, who's going to pay the fees? And it's a very expensive university, so I had to study very hard, and I was. And I did, and I passed I aced all my exams the first time. I never actually failed, so it was like something that was I was very proud. So I remember he came down once to visit me, and he said, "Where would you like as a reward? Where would you like to go?" And I said, "In India." I studied in India, by the way. And I said, as a young person, you always aim for the highest, the best thing, and where would I go, And I said, I want to go to Kashmir. And he said, yes, let's pack and go. And we did, and we had a blast. It was beautiful. Kashmir is beautiful. Mm-hmm. Of course, after that, there was a lot of conflicts in it and all that, but it was beautiful. The mountains, the lakes, the greenery. I have never been to Switzerland, but some people say it is almost like Switzerland with all that, the snow, the greenery, the mountains. Beautiful place. Mm-hmm. So that's my dad,
Yeah. And he said he always instilled that can-do attitude.
Yes.
That you've adopted. And I remember, I think it was our first time meeting at Toastmasters, you had said, I'm in my kind of say yes phase.
Yes.
And I guess you got that from him as well. Say yes to opportunities.
Say yes. Can do and say yes. I think they come hand in hand. Mm-hmm. I always say yes.
Yep.
And I always tell my children, if there is somebody tells you, say yes. Mm-hmm. Do it.
Yep.
Because it's an opportunity. Mm-hmm. What is you going to lose?
Yeah.
Say yes, try it. Mm-hmm. Which is very funny because I was going there for a walk, an archaeological walk, and in one of the walks that were organized by the Archaeology Society in Bahrain, and there was these Filipino in the community, and they were wearing all the same T-shirt, and they had like their club logo and stuff like that. And I said, are you part of a club or something? That's another thing my father taught me, talking to strangers and with chatting, kind of thing, which I love, which I enjoy to do. And so they said, yes, we are part of boat racing club. I said, really? Can I do it? And I was like, and I told my age. Said, of course you can. I said, yes, I can. Yes, I will. Come, join us. I said, yes, I will do that. And immediately she took my number, and then she sent me the time that they have to train. And I did. Patrick. I went there, and I joined that club. I think it's called the Dragon Boat. They have it's very hard work.
Dragon boat racing.
Yeah, dragon boat racing. It's very hard work.
Yeah, I'm part of a team, the Black Dragons.
Yeah, this is the other ones. Anyway, I did it with them for about 2 months or 3.5 months. And then it's then Ramadan, I think, happened. And then I told them, no, I don't think I will be able to do it. But I enjoyed it. I really enjoyed it, and they were also very happy with me with the. But I said, why not?
Yeah, try it.
Why not try it? Mm-hmm. It's hard work. We wake up very early in the morning. It was right after Fajr prayers, which is like in dawn, and then we pack, and then we just go, and then we were like rowing, and it's one of those days was really, really cold. Yeah, it's what. Like you said, I just said yes, and I did it.
And you were training at like probably 6 a.m., 5:30?
Yes.
Yeah, I used to. So I haven't been back this year. I've had some surgeries and injuries over the last 6 months. But I do hope to return someday because I do really enjoy it.
It's really good.
Getting up that early and going out on the water is.
It's so refreshing.
Yeah.
It is very refreshing, and but I wanted to continue, but then I said, look, it was I had other responsibilities and other stuff to do, but I tried it, which is like it's not like I don't know what it is like, but I did it, and they were very happy. They were happy with me. But I had a slight problem, and I always it's one of those self-deprecating problem, but I think it is a problem that I have, is that I lack coordination, and I know I do. Because sometimes I don't know the right from the left, and then they go in, and then they go, like we're rowing, and I have to follow him. So I will hit his row, and then they say, okay, go, you're going to be the last one. And So I said, this is, and the exercises that we have to do, it's like, it's the same problem happened with me for two kind of activities that I did. One of them was karate. The other one was taekwondo. I took karate when I was in university, and I was doing very well. I had very good strength, but I lacked the coordination. So I wasn't able to do the katas. I didn't know how to do this, and I had no remembrance of what to do, like from left and round. So that ended my karate career. And then taekwondo again, same thing. But I love the physical part. So I know that, you have a problem with coordination somehow. I don't know, like, some people don't know how to dance. They have, like they say, I have two left feet. Mm-hmm. But it's a real thing. It's a real problem. Mm-hmm. So I said, know your limits, accept it.
Yep.
This is something but I enjoyed it.
You tried it.
But I tried it. I'm like you said, yes. Mm-hmm. So when they said join Toastmasters, I said, yes, I'll do it. And then I realized, yes, this is something that I can continue doing. Yeah, and enjoy doing. So it's like.
Good for you.
Yeah,
I'm looking forward to hearing your humorous. It's going to be online?
Yes, it's going to be online on October 10th, it seems. Yes, right. Yeah.
And will they record those, do you think?
I hope.
Yeah.
I think they should. They will, yeah.
Yeah.
And you're going to attend there because if you're not.
What date is it again?
10th.
10th, okay.
On the 10th of April, yeah.
Sure.
So I don't know. It will be the first time I do an online contest, so that's going to be also tricky.
It'll add like a different sort of, I guess, dimension. So
yeah.
But you can use your science brain.
I did use the scientist. I went and researched. I went back 10 years ago when it was COVID time. Mm-hmm. Was it 10 years since COVID?
6.
6 years in COVID time.
Yeah.
Yeah, 2012. There were some videos also from 10 years ago. I suppose some clubs do also have online if they're like, even before COVID, when they're like contestants were from a different place or they couldn't attend. Mm-hmm. And some clubs were also having it online in Bahrain, even during when there was no problems and there was no COVID. Mm-hmm. So watching those and how they reacted and how they conducted those contests and how did they conducted their speeches online is also interesting. It's something that I have also to research more about.
Yeah.
Hopefully, ace it.
Yeah, I'm really looking forward to it, and because it's been a while since I've been because of everything that's going on now, and I just had travel and other things, but I'm looking forward to getting back into it.
Yeah.
I think it's been a fantastic chat today.
Thank you, Patrick.
Yeah,
I'm happy. I'm really glad that we did this.
Yeah.
And I wish you all the best with your future podcast.
Thank you very much.
It has been an honor to be on your podcast and talk.
Yeah, it's an honor.
Hopefully I give some kind of wisdom.
I'm sure you give a lot. And is there any sort of closing remarks that you would like to make as, I guess, someone who has lived through a career, raising a family, being a grandmother?
Yes.
And I guess being raised with that whole can-do, yes attitude, what would you try to leave for people as a bit of inspiration?
I had this motto and I live with, and if one of my a younger colleague or a younger person comes up to me and asks for my advice when they're like doing they're trying to choose a specialty or whatever they're going to do, and I used to tell them, if you don't get what you love what you get. Mm-hmm. So life, it's unpredictable. The only thing about life, it's unpredictability, the randomness. Mm-hmm. There are some things which are out of our control. There are things that we plan for, but God decided something else for us, or our chance, or whatever, we got something else. So don't despair. Don't just say, no, this is not what I want, and I have to go for it and search for it and keep on, searching for that. Take what you want, what you get, whatever profession you got. Remember, I got pediatric emergency. I got pediatrics incidentally. I was like an accidental. I just finished my internship and somebody said, why don't you come to pediatrics? And I said, yes. And I went into pediatrics because basically I also like pediatrics. So I was really happy that, that there was an opportunity and I was taken immediately. And I didn't have like any wasted time. I was lucky on that time. But then when it comes to my specialty, I had something else in mind and I was doing research on it and I was doing some other specialty, but that didn't work. And I was feeling a bit miserable about it. Mm-hmm. But then they offered me pediatric emergency and said, there is a need for this. And I said, what is this emergency? It's like, is that an emergency medicine? Is that actually a specialty? But when I went into it, I loved it. I had like intentionally loved it. So what I didn't get, what I got, I eventually loved. Mm-hmm. So I would encourage everybody, don't be a mediocre at your job. Take it seriously. Do the best. Mm-hmm. I remember there was this really very fascinating young man, and he was working in our neonatal unit, and he was working as a cleaner. And he was doing the best job as a cleaner. He was so attentive. Mm-hmm. He used to make the place so clean. He flourished everything. Sometimes he'll find our books, our bags, and he will like tidy them up. He's very attentive every time. And the place was so clean. He took pride in his work. Mm-hmm. And that boy, young man, I eventually knew that he was studying in the evenings to finish his education. And then later on, he went to university. And then he got a very good job. He was so successful. So if you are successful in these menial jobs, mm-hmm. and you took it so seriously and you showed the work ethics that, you love it, go on and doing it with whatever job. Be the best in whatever you are doing, mm-hmm. And then people will look, wow, he did a great job. So that is something like I would advise. I always advise my children, and whoever wants to listen. Yani in Arabic means I mean.
Yani, yes.
Yes.
I've heard that quite a lot. Yeah, it's one I think I just assumed that's what it meant because people would use it. They're speaking English to you and then they'll say Yani.
Yani. So I know. I just slipped in.
Yeah, no, it's good.
It means that. If you don't get what you want, if you don't get what you love what you get.
Yeah.
So it's something that I have always. So if I get something, I put my heart all into it. Mm-hmm. I do the best job there is. I become the best in it. I became the best in pediatric emergency. I did my best to for my patients, for my students, and for the profession. Mm-hmm. And I did research, and I loved it. And then they were like, when it came at the age of 55, and they said, why are you retiring? You're very young, and you're in your, when a player retires and they are in their peak of their career, mm-hmm. their prime. I said, you're in the prime. And I said, yes, that is the time when you should leave. Mm-hmm. You should leave when you are in your prime.
Leave on a high.
Leave on a very high note, what I mean? It's like, people remember you for that. Don't wait until you're like old and then you stop making mistakes and then you're like, people said, oh, when is she leaving? She's already very old. We need a chance. These old people, they're all taking their jobs, something like that. No, and I also thought time. Time is a commodity and I was running out of it. I mean, we all know it. Like they say, live like you are going to die tomorrow. Mm. Learn like you are going to live forever. Mm-hmm. But live like you're going to learn tomorrow. So time for me was precious, being with my family, making memories, traveling, doing something different. Mm-hmm. And each stage is great. So enjoy every stage of your life. That is one thing I would advise you, Patrick, to do.
Fantastic. Thank you very much, Dunia.
You're welcome.
This has been great.
Thank you.